guys, it's Brittany here from My Core Floor, and we are back this week for part 2 in our pelvic floor series leading up to Sunday night's webinar. Hopefully you guys have registered. If you haven't yet, I'll include the link below again so that you can get signed up. Sunday's webinar will start at 7 also, Eastern time, and it is going to be how to stop the 3 pelvic P's: peeing, prolapse, and pain. So we're just doing a little mini series leading up to that webinar. So last Thursday night, we talked about what is the pelvic floor, because so many women just don't even know kind of what it is, that it's a group of muscles and what it does. So last Thursday, we did kind of a chat on just what is the pelvic floor. Tonight, what we're going to talk about is incontinence and prolapse, which are 2 really big conversations because 1 in 3 women actually suffer from urinary incontinence. Currently right now. So if you think about, back in the day when we used to go out with friends, if you are standing in a group of women, 1 in 3 have some sort of form of urinary incontinence. So that's a pretty high statistic. That said, research is even showing, guys, that it's closer to probably 1 in 2 women, because women aren't always truthful on forms. And as we age, those statistics only get higher. So it's a really big topic. It's really important. So even if you don't have incontinence now, there's a good likeliness that at some point you could. And so what better not than to be preventative rather than have to try to play catch up. So this talk is really for every woman, whether you have incontinence issues or don't. So let's dive in, because I'm going to try to keep this one tonight at about 20 minutes, because incontinence and prolapse, there's some pretty big topics and there's some big things to talk about. So we're going to shoot for 20 minutes. So we'll see how I do. So incontinence. What is incontinence? Incontinence is any involuntary or accidental urine leakage. Any, guys, is really the key here. I had a client one time come in and say to me, and I said, "Oh, I heard you're experiencing some incontinence from the doctor's notes." And she said, "I'm not. I don't have incontinence. I just leak a little." Guys, leaking a little is incontinence, whether you want to admit it or not. I feel like when you hear the word incontinence, you want to think of like your grandmother wearing a diaper at the nursing home. But incontinence is any involuntary small loss of urine, whether it's a couple drops, whether it's a full bladder loss. That is both considered incontinence. So that's kind of the first thing to talk about. Then there are different types of incontinence. And I don't care that you guys know what the types are called, but I like to just let you guys know that there are different ranges, and sometimes different things can cause different types of incontinence. So it's good to kind of understand that. So there is urge incontinence, which means you have difficulty getting to the bathroom on time without leaking. So that's where you get that really strong urgency. And then it's like, I need to be at the bathroom yesterday. Like, I need to be there now. And if you don't get there now, then there's some drips that start to come out along the way, or you start losing your full bladder along the way, and that's never a good thing. So that's urge incontinence. Stress incontinence is leaking with coughing, laughing, sneezing, any increase in intra-abdominal pressure. So if you're running with your kids or you're trying to jump on the trampoline and you leak, that's considered stress incontinence. And then the third type is actually just mixed, which is really a combination of both stress and urge incontinence alike. So one of the big things I always like to talk about with incontinence is how many of you either now or at some point thought or still maybe think that incontinence is a normal part of the aging process, that you get to a point where it's just normal. Like, oh, I'm older, I've gone through menopause, or oh, I've had kids, or how many of you have ever just thought that maybe it was just a normal part? And if you do, that's okay. I have a lot of clients that come in to see me that will say, "Well, I'm older, so is there really anything you can do about this?" Or, "I've had kids, I've had multiple C-sections, I've had multiple vaginal births. Is there anything that can really be done about this incontinence?" And the answer is yes. And while incontinence is a highly common thing, that does not make it normal. And that's always one of the things I like to drive home to people. Common and normal are 2 very different things. Yes, it's really common. I just said 1 in 3 women are suffering from some form of urinary incontinence. So common, yes. That does not make it okay, and that does not make it normal. And so there is not an age, I will repeat, not an age where it becomes okay to pee your pants. I don't care if you're 90, I don't care if you're 80, I don't care if you're 25. Never an age where it becomes okay to be peeing your pants or normal. Now, there's a lot of things that happen to us in our life that make it, a likeliness of developing incontinence. And that's, I think, why people think it's so normal. Because certainly pregnancy and trauma during childbirth can cause weakness of the pelvic floor, can cause damage to the pelvic floor. and can lead to incontinence issues. Pregnancy alone, just the weight of the baby overstretches that pelvic floor. And so even if you don't have a traumatic birth or you have a C-section, just pregnancy alone can actually weaken the pelvic floor to make incontinence a likely thing afterwards. Then let's talk about hormones. As we age, we start to hit perimenopause and we hit menopause. Our hormones changing, decrease in estrogen down to those muscles and to those tissues can actually cause them to start to atrophy. And when they start to atrophy, they start to kind of shrink up, which makes it harder for them to activate and to function the way they normally should. So changes in hormones do make incontinence a common thing. Diet. There's some dietary things that can come into play with incontinence. So spicy foods can cause greater issues with incontinence or greater urgency. We all know alcohol. If you drink, you're likely to have increased frequency, and occasionally people will have incontinence issues. But there's other things. Anything acidic can be really irritating to the bladder, and it makes the bladder want to get rid of whatever is inside of it. So spicy, acidic, chocolate, alcohol, there's lots of things on the list that actually can contribute to urinary incontinence or bladder irritation that makes your bladder want to get rid of or expel whatever is inside. So there's a lot of factors to consider, guys. The other thing is injuries. And that's not one that people often take into account. When I do a one-on-one eval with somebody, one of the things I always ask is, have you had any sort of orthopedic injuries? Have you had hip bursitis or an ankle sprain or an ankle fracture or a pelvic fracture, a tailbone fracture? And people don't realize the relationship between having some sort of injury or trauma to your body and your pelvic floor and potentially developing incontinence. We talked about on Thursday, I'm going to pull my model back out, but the importance, if I kind of flip it over here, so actually we'll do this way so it makes it a little easier. Tailbone is here, here's your spine. So pelvic floor has muscles that move in 3 directions. So the arrows show which directions the fibers run in. So it's really important for your pelvis to be able to move forward and back, to move side to side, and to rotate in order to activate those pelvic floor muscles. It's also important for them to be able to move vertically as a group of muscles to activate that pelvic floor. If you have trauma, if you've been in the hospital, you've been on crutches, you've been bedridden in a cast or some sort of thing, tailbone fracture, you're not moving around, you're on bed rest during pregnancy, any of those injuries or traumas to your body that affect your movement can influence your body's ability to have good pelvic floor function, which means you can develop incontinence. So I've had women that I will be talking with them in their one-on-one, and they'll say, well, the incontinence has been going on for about 2 years. And I'll say, well, what happened at the time that started going on? And so we start kind of looking back into when it started to develop. And sometimes it'll be, oh, well, I had a really bad fall, or I had a fracture, or I was on crutches. And I'll say, well, think about how your body was moving when you were on crutches, or when you were having some sort of pain, or you were recovering from an injury. Your pelvis, I'm guessing, was not moving all around the way it needs to in order to activate that pelvic floor. So injuries are another thing to always kind of keep in mind that can really influence your pelvic floor function, because really the thing the pelvic floor needs to activate is the movement. And so injuries, pregnancy, trauma, all those things can influence your ability to have good pelvic floor function and to be continent. So those are a lot of factors to consider in addition to diet and hormones. So when you take all those things into account, guys, yeah, it's really common for people to develop incontinence because there's a lot of factors and things that go on in our lives that can lead to incontinence. Still doesn't make it normal. And the big thing to know is that there are things that can be done about it. And again, like anything, the sooner you start addressing it, the better it'll be. So what do we do in My Core Floor? And what do we do in the free My Core Floor group if you guys are in there? We give exercises every week. In the My Core Floor membership, we do workouts every week so that we can activate that pelvic floor through movement, 3-dimensional movement of the pelvis, of the hips, of the spine, taking into account all sorts of factors, injury factors, tightnesses that develop with pregnancy, tightnesses we just develop through lack of movement, through sitting at a desk all day, through repetitive patterns. If we do a job that requires us to do repetitive work movements, that can kind of send our body down a path where we start to lose mobility. And so when you're talking about incontinence, I want you to think about how it goes way beyond Kegels. A, it's not normal. And B, it goes beyond just doing some squeezes while you're sitting at your desk or sitting in the car at the stoplight. squeezing for 2 seconds, squeezing for 10 seconds. It goes into your whole body's ability to move in 3 planes, specifically through the pelvis, through the hips, and through the spine. And so I want to just touch on that. Now, when we get into the webinar on Sunday, if you guys are coming or if you catch it on replay, we are going to talk about self-assessment. How can you assess your pelvic movement? What are some exercises you could start with that are good ones to really get going right away? That's all going to be part of the webinar on Sunday night. But I wanted to just touch base tonight a little bit on the kinds of incontinence, what factors in with incontinence, and what we do to address it that's different than just your typical kind of Kegels or surgery options or medication options, okay? The other thing I want to talk about tonight is prolapse. And I actually had a friend say to me the other day, you know, until I started watching some of your stuff, I didn't even know what a prolapse was. So first off, what is a prolapse? So a prolapse is when one of your pelvic organs starts to drop into your vaginal canal. So you might be thinking, what the heck and how does that happen? There's a lot of different factors that can start to cause a prolapse. Certainly pregnancy, weight of the baby can start to push things down. Traumatic deliveries. One of the courses I went to one time said babies take souvenirs. So in pushing out in delivery, things can start to drop down and shift around in places that they don't belong. Sometimes having something like a hysterectomy can actually begin to cause a prolapse. Sometimes even if you're having a hysterectomy because of a prolapse. Sometimes if the uterus drops down, the doctor's fix is to be like, well, let's just do a hysterectomy. We'll just take the uterus out if it's dropping down. Problem is, guys, is that it's a cavity and the organs are stacked nicely. When you remove one of them, there's a lot more room for things to start shifting around. So sometimes a hysterectomy is not always a good quick fix to solve a prolapse issue because sometimes things will then start to shift afterwards. Increased intra-abdominal pressure, so Valsalva. So when you have bowel movements, if you're really having to bear down and push a lot, if you're holding your breath, constipation can sometimes lead to prolapse issues because of that reason. Other factors that can play into prolapse is heavy lifting. And that's not to say that heavy lifting is bad. You know, there's been a lot of like, oh, you shouldn't lift anymore if you've had prolapse. I've read that in articles and magazines and had people come in and tell me that their doctors have told them that. Lifting is not bad, but what is bad is not having proper mechanics and not having a strong enough pelvic floor to counterbalance that lifting. So heavy lifting, you have to be able to take breathing into account to really influence the load and how much pressure is coming down on your pelvic floor and on your internal organs. And so that's a factor to consider that can also play into prolapse. And if you're doing a lot of like plyometric jumping work, so if you've had some pelvic weakness, maybe you're in your postpartum period and starting to exercise again, if your pelvic floor isn't strong enough and ready to take on, you know, a plyometric workout, jumping jacks, running, sometimes that increased pressure in your abdomen pushing down on the organs, if your pelvic floor can't counterbalance that pressure, you will start to develop some prolapse issues, and I have seen that. So for some women, it's hard to imagine kind of what does a prolapse look like. So you get my artistic talents tonight, okay? Here is my drawing of what a normal kind of pelvic organ situation is. So you'll see that there's the rectum, the uterus, and the bladder, and they're all kind of nice and neatly stacked on one another. You'll see on the bottom, the pelvic floor muscles kind of run through here, supporting everything, okay? And then you'll see the urethra and you'll see the vagina, okay? So that's what it should look like. Everything is nice and neat. You can see the urine in the bladder, okay? Everything just drains right out through the urethra. And this is all functioning normal, okay? So now let's talk about a not so normal. What is normal prolapse situation, okay? And this is a drawing of what they would call a cystocele, which is when your bladder starts to prolapse down into the vaginal canal. So really any of your organs, guys, can prolapse in. Your rectum can prolapse down, your urethra can prolapse down, your uterus can prolapse down, and so can your bladder. So really any of those pelvic organs, and sometimes for different reasons, will or can prolapse down into the vaginal canal. So I want you to see the difference here, okay? So now you can see where the urethra almost looks like it's sitting in the middle of the bladder because part of the bladder has now dropped into the vaginal canal. So unlike in this picture, where you can see, here's the bladder, boom, everything drains down the urethra. In this one, now the bladder becomes a little more kidney shaped, the urethra sits in the middle. So prolapse, guys, can actually be a reason that sometimes people will develop some incontinence. Sometimes if you've ever had some post-void dribbling where you go to stand up and you think you've emptied your bladder and then all of a sudden there's a few drips that show up out of nowhere, that can sometimes actually be from a prolapse. So what happens with a prolapsed bladder specifically is that the urine will fill up, okay, and then it drains out. But because this part is pushed into the vaginal canal, it can't drain out the way that the rest of the bladder empties. So it stays in here and your body doesn't register it because your body thinks it's emptied the bladder out. So then when you go to stand up or you go to maybe jump with your kids or you go to do something unexpected, you have to run across the street for traffic, all of a sudden you get a splash over and your body is not reacting to hold that in because it doesn't even realize it's there because it's prolapsed down into that vaginal canal. Now, in the same way, the uterus can actually drop down or even the rectum can push down from the back and collapse in as well. So that just gives you guys a little bit of a visual to understand kind of what is happening with the prolapse that, it's collapsing into the vaginal canal. What are symptoms of prolapse? So often women who are experiencing prolapse will report a vaginal heaviness. So they feel like there's some sort of heaviness in their vagina. They can't really describe it. It just feels like something is kind of there and heavy and like it shouldn't be there. Some women will report feeling like they're sitting on a tennis ball. So they go to sit down and that organ has dropped down so much that they're actually feeling it when they sit. So it feels like they're actually sitting on something. Again, sometimes incontinence can be a symptom of prolapse. So there's different things that different women will experience. How do you deal with a prolapse? So what do? Can you fix a prolapse? Absolutely. There are certainly surgical corrections for prolapse. Personally, I am not a huge fan of the surgical route being your first kind of go-to for a couple reasons. It's an empty cavity, guys, that your organs are suspended in. And when you're trying to lift up a organ and resuspend it, there's not a lot of places in an empty cavity to suspend something to. So there's been a lot of different surgical techniques over the years to attach the organs in different places. And it really, oh, sorry guys, something's jumping up here on my computer. So it can sometimes fail because there's not a good place to suspend it. And if you don't correct the problem for the prolapse, so what was the reason? Are you constipated? And if you're continuing to be constipated and having to bear down and push a lot during bowel movements, you can reprolapse. Or if you're someone who does a lot of heavy lifting and you don't have good mechanics or good breathing techniques, and you go right back to doing that eventually after you've healed from surgery, prolapse can return if it's not a good, surgical attachment. And I just think it's a technique they haven't quite perfected yet because, again, I think it's a difficult thing to perfect when you're trying to attach something in an open space. So there is a surgical option, and I understand there are cases where that definitely has to be done. I just always recommend people don't run there first. Don't look for the quick fix. Sometimes the quick fix, like I said, the grass isn't always greener on the other side. It seems like an easy thing, but there are complications and things that can come with it. And if you don't fix the problem for the prolapse in the first place, whether it's coming from pelvic floor weakness, constipation, a combination, trauma during pregnancy or delivery, if you don't fix the reason it happened in the first place, there's a good chance even if you have surgery, it could come back. And so that's always something to consider. A pessary is another option that people will use with a prolapse. And what is a pessary? It's kind of like an old school diaphragm. There's different kinds and shapes that they make, but one of the most common ones is a donut shaped. And basically you fold it in half like you would a diaphragm and you insert it into the vagina and it pops open and it basically just holds the internal organs up there. And I had someone recently ask me, what's your take on a pessary? Do you think it's good? Do you think it's bad? I certainly think pessary is a great option. It's certainly conservative. It's not surgical. It takes care of the problem for most women. Sometimes there's a little bit of a fitting issue, so you got to sometimes play around with different sizes to find the right fit. Just like everything else, vaginas come in different shapes and sizes for every woman, so you got to find the right fit for you. I personally like to have people use pessaries when they're in pelvic PT to start with, because I think it's a great way to allow us to push them a little bit with exercises before they start getting that heaviness and discomfort feeling that the prolapse can create. And so I like to sometimes have them use the prolapse early on in PT while we're starting their exercises, starting their training, getting their pelvic floor stronger, building their pelvic floor endurance, and then have them start to take the pessary out and kind of wean off of it. And so a lot of times I'll have women where they're able to really wean off using it. Maybe they'll just occasionally use it if they're going to do something really strenuous. So going for a strenuous hike or a day where they're on their feet all day long, and they know that the pelvic floor might get weak and kind of lose its endurance and the prolapse may start to descend. So a pessary is a great option and something that I certainly will use in conjunction with PT. Like anything else, pelvic floor PT or my core floor or the my core floor exercises from the free group are also a great option to help address prolapse. So pelvic floor supports those organs. You can see in the picture here. There's your pelvic floor, okay? Runs right across the bottom underneath. If it's strong enough, it will support those organs. And even if you've had a prolapse already, you can get the organs strong enough to actually lift them back up a little bit. So it is possible with exercise to improve a prolapse. And certainly, like anything, the sooner you address it, the better. It is also possible, guys, to have a prolapse and be asymptomatic. And so I would also really encourage you to look at your vaginas. I know this sounds crazy. And I know for a long time, and again, depending on your age and what generation you're from, the idea of looking at your vagina feels very kind of taboo and kind of creepy. And no, I don't want to look down there. I have clients who are like, I don't want to touch it. I don't want to look at it. I get it, guys, but it's part of your body. And it's really important to understand what's going on with your body. And so I will often encourage women to take a mirror and look at your vagina. Do you see anything bulging out? Do you see something at the opening, even if you don't necessarily feel it? Look at your vagina. Ways to assess for a prolapse: you can actually just bear down like you were going to have a bowel movement, kind of push out. And if you have a prolapse, it will actually push down forward and you'll be able to see it. You can have a prolapse and be asymptomatic. Guys, I actually have a small prolapse after having 2 children. I'm asymptomatic completely. I manage it just with pelvic floor exercises, and that's it. It is very possible. My goal is to continue to manage it with exercises so it doesn't become an issue. So I just want you to know, look at your vagina, but if you see something there, don't panic. Or if you're starting to notice some heaviness or some discomfort there, or feeling like something's there that you're sitting on, or you in the shower and you wipe or you wash and you're like, oh, wait, what is that? Don't panic. There's things you can do about it, but it's good to know because there's power in knowledge. Knowing about your body, knowing what's going on with it gives you the power to take back control over it, to know what exercises to do, to know to reach out to a pelvic PT. That's one of the great things about my core floor is I tell the women in my membership, and I mention it in the free group, and I'll mention it again here on the page. I am your access to a pelvic PT. So if you don't have one, or you feel uncomfortable talking to your doctor about it, or you're not sure, shoot me a private message, comment on one of the videos. It's okay. This is the place for you guys, or it is a place for you guys to ask the questions. And if you're curious or you don't understand, it's a safe space. I have been doing this for 19 years. I love what I do. I love helping women to learn more about their bodies, to learn what's going on with them so that they can take over control and have better quality to their life, so that their life is not dictated by their prolapse. It's not dictated by their incontinence and having to bring a change of clothes or having to bring pads with them, or having to worry about Kegel exercises. So have this be your place where you can ask the questions. Look into the My Core Floor membership. Join the free group if you're not sure what kind of exercises we're talking about. The big thing I want you guys to take away from tonight is that incontinence is, yes, common, but it's not normal. And there is something that can be done about it. And a lot of it is things that you can take control over today through movement, through exercise, through understanding your body, through diet. There's a lot of factors that you guys can have control over that can actually improve your pelvic health today and into tomorrow and the years ahead. So that's a wrap on incontinence and prolapse. 23 minutes, not too bad. Again, if you have not signed up for the webinar Sunday night, go ahead and click the link. I'll put it in the comments below. Sign up, come join us. We're going to chat more about pelvic floor, about incontinence, about prolapse. I'm going to teach some self-assessment tools. I'm going to show you my 3 favorite pelvic floor exercises that you can get started with right away as a little mini program to get yourself off to a start with improving your pelvic health. So check it out Sunday night. And I will also be back here Thursday night to chat a little bit about pelvic pain. So if you are someone who's dealt with pain with sex, pain with gynecological exams, endometriosis, menstrual cramps, abdominal pain, constipation, and cramping that comes from that, if you have ever dealt with any sort of pelvic pain, then join us again Thursday night, 7 o'clock Eastern time. We'll be back to chat more about pelvic pain and some options and things that you guys can do to help improve that. So have an awesome rest of your Tuesday night, and I'll see you guys back here on Thursday. Take care.